Hi all, this is Priyadharshini working as an assistant professor in the Department of Artificial Intelligence and Data Science. Today we are going to discuss a case study on the data analytics in healthcare industry. Let's get started. So in brief, data analytics in healthcare encircles a branch of analysis that concentrates on the provisional insights gathered through hospital records, clinics, patient records, diagnostics, etc. Personalizing healthcare through predictive analysis is also a massive study. So, harnessing big data analytics in healthcare is a massive program. Predictive analytics in healthcare establishes using workforce scheduling and staffing. So in healthcare, large amount of heterogeneous medical data have become available in various healthcare organizations. This healthcare data could be an enabling resource for deriving insights for improving care delivery and reducing waste. The enormity and complexity of these data sets presents great challenges in analysis of applications to a practical clinical environment. In this series of lecture, we will be exploring the intersection of big data, healthcare and big data. At the end of this lecture, we should develop understanding of healthcare data, analytics algorithms and understanding the big data systems. The healthcare industry is huge and there is a lot of data coming out of health. In US, healthcare industry is incredibly expensive. Overall, spending is almost 4 billion trillion in US. That's more than the value of 10 biggest companies plus 10 Beijing Olympics plus a Warren Buffett and a Bill Gates. But does it have to be that way? There is a massive waste in healthcare, unfortunately. The estimated waste in US healthcare alone is $800 billion. That's equivalent to NASA's total budget for the past 50 years. It is a very big chill. Not only the cost is an issue, but also the quality of healthcare is very poor. There are 200 to 400,000 deaths every day. That's 1,000 people per day. If we classify the preventable deaths against other causes of deaths, it will be the number 3 causes of deaths in the United States is only heart disease and cancer. So there are massive problems present in modern healthcare, including high cost, high waste and low quality. How can big data help? The hope is big data can lead to better care and lower cost. In big data, people talk about the 4 V's. Volume. Healthcare generates a large volume of data. For example, for genomic data, each human genome requires 200 bytes of raw data or megabytes if we store just SNPs. For medical imaging data, a single MRI is about 300 gigabytes. Medical imaging data generated in the US per year was estimated to be 100 petabyte. Variety. Healthcare also generates a lot of different kind of information, such as clinical information including patients' demographics, diagnosis, procedure, medication, lab results and the clinical notes. Patient also generates a lot of data such as information coming across other devices that patients wear. Velocity. Healthcare also generates a lot of real-time data such as blood pressure measures, temperature, heart rate, drug dispensing levels at intensive care units. Veracity. Unfortunately, healthcare data often comes with a lot of noise, a lot of missing data, a lot of errors and a lot of false alarms. It's a big challenge in healthcare data analytics. So I'll come again with the 4 V's of big data. So it is volume, variety of information, velocity of information, veracity of information. So as we say, volume, it is a scale of data. Variety, it comes with different forms such as structured data, unstructured data and semi-structured data. Velocity, it deals with the real-time data which is very huge. Veracity, so veracity means uncertainty of data. So this is a big challenge in big data. So how are we going to deal with this is a major concern. So the first thing is the hospital quality and patient safety in the ICU. So this will be the first challenge: hospital quality and patient safety in the intensive care units. Using routinely collected EHR data as the fodder for an algorithm that gives clinicians an early warning about sepsis, which has a 40% mortality rate and is difficult to detect until it's too late. Predicting surgical risk, helping match patients with the right course of action that will keep them safest during their